Hi everyone, my name is Mike Crane and this is my Leadership Action Plan video for Nursing 4500. Today I'm going to walk you through a real issue from my clinical setting, the plan I developed and what I learned from collaborating with others, and how this project contributed to my growth as a nurse leader. The issue I focused on is inconsistent ventilator weaning and wound care communication between shifts and between nursing teams and respiratory teams. On my unit, weaning success often depends on the nurse knowing the plan. When the nurse doesn't know what the respiratory team is planning, weaning can be delayed, or the patient becomes fatigued due to poor timing or plan deviations. Wound care has similar problems. Orders change or get updated by the wound team, and that information doesn't always make it into shift report, which means treatments can be delayed or done improperly or incorrectly. This matters because insurance limits the time a patient can stay on our unit. When we lose days because of communication gaps, both ventilator weaning and wound healing slow down, which directly affects the patient outcomes. My action plan focuses on creating structured and predictable communication between RTs, nursing, and the wound care team. The first part is a short respiratory therapist to nurse weaning briefing at the beginning of every shift. This is where the RT explains the plan for the day or night, what they need from the nurse, and what to watch for. Next is strengthening SBAR during nurse-to-nurse report by making weaning status and wound care updates required sections. Along with this, we would implement a short quiet zone during report. This is a 10-minute protected period at shift change where non-urgent interruptions pause so nurses can focus fully on handoff. Since interruptions are a major cause of missed weaning info and wound care details, the quiet zone supports the accuracy of report and keeps it distraction-free. The third piece is having the RTs give a mid-shift update to nurses whenever the weaning plan changes. And finally, wound care orders, especially changes, need to be verbally reviewed during report so the oncoming nurse can prioritize them. This aligns with organizational goals because it uses our time efficiently, supports faster recovery, and increases safety through consistent communication. This change matters because communication failures directly delay recovery. When the nurse doesn't know a weaning attempt is happening, the patient might not be ready, or the nurse can't monitor for fatigue the way they should. That leads to failed weaning trials or reduced tolerance. For wound care, missed or delayed treatments slow healing and increase infection risk. Even though these changes seem simple and obvious, they make a big difference in patient outcomes by preventing small errors that can snowball into major delays. Structured communication fixes these problems by keeping every shift aligned, reducing duplicated work, and creating safer workflow. Overall, these changes help patients progress faster, help staff understand the plan, and improve the way the team works together. This project was built through collaboration with several people on my unit. I interviewed our charge nurse, Jared Knighton, and our respiratory manager, Sandra France. I also had many informal but meaningful conversations with multiple nurses and respiratory therapists during my shifts. Everyone contributed different perspectives on what slows down weaning and where communication falls apart. These conversations helped me understand the real workflow barriers and what would make sense in day-to-day practice. Collaboration was essential because it uncovered blind spots I would not have seen on my own. Since I work both nursing shifts and respiratory shifts, I have a unique perspective. I understand what respiratory therapists need to make weaning successful and what the nurses need to manage the shift and prepare the patients. This dual role experience helped me translate expectations between the two groups and build a plan that respects everyone's workflow. Good collaboration also strengthens teamwork, reduces frustration, and improves consistency from shift to shift. The contributors made a big difference in shaping the final plan. Jared helped me identify the gaps in SBAR and how small interruptions during report lead to missed wound care updates and weaning info. He also is the one who encouraged trying to structure a quiet zone during report, which directly influenced the plan I created. Sandra explained the respiratory perspective, especially how important fatigue monitoring is, and how essential it is for nurses to know the plan before a weaning attempt is started. The nurse and respiratory therapist I spoke with pointed out real-world issues, like inconsistent wound care updates, unclear expectations, and timing challenges between departments. Their input made the plan practical, realistic, and something the team could actually use. This project helped me learn a lot about myself as a leader. I learned the importance of slowing down and listening to the different perspectives of each team member. I realized how valuable structured communication tools are, especially in a busy LTAC or long-term acute center, where priorities shift constantly. Cotter's change model helped me see how important it is to create buy-in and build a shared vision amongst the team. I also strengthened my confidence in communicating across departments, especially since I had the experience of working both roles. This project helped me meet the BSN teamwork goal by working effectively with other professionals, integrating their ideas, and building a plan that improves outcomes for patients, staff, and the system as a whole. I'll take this experience with me into my career because strong communication is the foundation of safe, patient-centered care. In conclusion, consistent communication between nursing, respiratory therapy, and the wound care team is essential for safe and efficient patient care. My recommendations are to implement the respiratory to nursing weaning briefing, strengthen SBAR for weaning and wound care, and use quiet zones or protected time during report to avoid interruptions, since this directly improves accuracy and reduces misinformation. These changes may look small, but small changes done consistently can create huge improvements of safety, workflow, and patient recovery. Moving forward, piloting this plan and getting feedback from staff will help refine it and make it sustainable. My final message is that nurses and respiratory therapists share responsibility for helping these patients recover. And when communication is predictable and consistent, everyone benefits, especially the